video is about type 2 diabetes mellitus. It is a medical condition where your blood sugars are uncontrolled or elevated. Insulin is a hormone secreted by a group of cells in your pancreas into your bloodstream in response to elevated blood sugar. Insulin facilitates uptake of blood sugar from bloodstream into your muscles and fat, which is how it brings down blood sugar. Type 1 diabetes, in type 1 diabetes, the cells secreting insulin in pancreas is destroyed, resulting in an absolute lack of insulin. Type 2 diabetes, on the other hand, is because of a combination of impaired insulin secretion by pancreas and insulin resistance, where insulin, even though present, is not able to do its job properly. After a while, type 2 diabetes can behave like type 1 diabetes because insulin production by pancreas can eventually shut down. These patients are called insulin-dependent type 2 diabetes. These patients would require insulin from then on. Tablets would not work. Today's video is about type 2 diabetes mellitus. 90% of diabetic patients are type 2 diabetic. The onset of type 2 diabetes is usually after the age of 40, but can appear much younger. Many patients do not have any symptoms for a significant period of time and can develop complications from the disease because even before finding it out or diagnosing it. This is why it is important to screen for diabetes. In medicine, screening means looking for a particular disease every year or every few years by doing the test for it, even though the patient hasn't developed any symptoms yet. This is to facilitate early detection and prevent complications from these diseases. What are the factors predisposing for type 2 diabetes? Genetics play a major role in type 2 diabetes. Type 2 diabetes tends to run in families than type 1 diabetes. The other factors are being overweight or obese, which causes insulin resistance, where insulin is still present but cannot function efficiently. Inactive lifestyle, diet rich in simple carbs and sugars, sugary beverages like sodas and fruit juices add to the problem. There are also certain medications like steroids, which increases blood sugars, making one diabetic. In a nutshell, if you're diabetic, it is mainly not your fault, it is your genetics mainly. You are predisposed to it. But being overweight, poor diet, inactive lifestyle, all these can make diabetes appear earlier or make it worse. What are the symptoms of type 2 diabetes? Most common symptoms are increased thirst, increased urination, rapid weight loss, and intermittent blurry vision, which happens when the blood sugars are high. Unfortunately, some patients present with symptoms of complications from it. Diabetes is diagnosed by measuring blood sugar levels in your blood. A patient is diagnosed to have diabetes when 8-hour fasting blood sugar is above 126, or random blood sugar, which is blood sugar tested without fasting, is above 200. There is another test called glycated hemoglobin, or hemoglobin A1C or A1C, which has made diagnosis as well as management of diabetes slightly easier. The A1C value is a reflection of 3-month average of a patient's blood sugar. Normal A1C value is below 5.8. 5.8 to 6.4 is considered borderline diabetes or pre-diabetes. When A1C is above 6.5, the patient gets diabetes diagnosis. The usual A1C goal when we manage diabetes is to keep it less than 7. A1C above 7 is when complications of diabetes appear, hence the goal of 7. When diagnosing diabetes, these tests are recommended to be repeated once to decrease error of diagnosis. If there is a suspicion of type 1 diabetes, which is managed entirely differently, they need insulin from the get-go. There are certain markers or antibodies which we order in blood work to differentiate it from type 2 diabetes. Now let's get into the complications of diabetes. Diabetes is probably the disease with the largest number of complications affecting almost every organ in your body. Some of the major complications from diabetes is because of accelerated plaque formation in blood vessels called atherosclerosis, causing obstruction of blood flow. Some examples are heart attacks from clogging of arteries supplying the heart, strokes from clogging of arteries supplying the brain, peripheral vascular disease from clogging of arteries supplying your extremities, which can result in losing limbs, diabetic retinopathy, which is damage to your eyes from impaired blood supply to the retina. Diabetic peripheral neuropathy is damage to nerves causing pain and numbness of hands and feet from clogging of small arteries supplying these nerves. Other complications of diabetes is from a direct toxic effect of high blood sugar. Prime example for this would be diabetic kidney failure. Diabetes is the most common cause of kidney failure and dialysis. Early diabetic cataract is another direct toxic effect. A combination of decreased immunity and high blood sugar of diabetes also predisposes patients for recurrent bacterial and sometimes fungal infections. Common infections being pneumonia, which is infection of the lungs, or urinary infections. Hence, all diabetes patients should get pneumonia vaccine one time in their adulthood. So let's get to the management of diabetes. I'm going to discuss diet and lifestyle management in this video. Medications will be in a different video, to make it smaller videos. Whenever you go to doctor's office to discuss diabetes management, it is very important that you bring your blood sugar values with you, which you have to measure yourself at home and create a log using a glucometer. You prick your finger, put a drop of blood, and check your sugar. Diabetes is said to be controlled when before meal blood sugars are less than 130 and after meal blood sugars is less than 170, or A1C, which is a reflection of 3-month average blood sugar, is less than 7. Before meal blood sugar should be taken just before meals, and after meal blood sugar should be tested 1 to 2 hours after meals. Someone whose blood sugars are well controlled, once daily glucometer measurements taken during different times of the day is all we need. For example, if you took it today before breakfast, the next day you take it 1 to 2 hours after breakfast. You have to document it as before breakfast or after breakfast in your log. For someone whose blood sugars are very uncontrolled, we typically ask them to check it before all meals, which is typically 3 times, and at bedtime. We use these numbers to adjust or add medications during your doctor visits. Now there are these continuous glucometers or CGMs. Insurance typically covers them if you have to check 3 to 4 times a day and you're also on insulin therapy. The benefit is continuous monitoring and no need for a recurrent pricking of your fingers. There is only a small prick during installation of a CGM sensor on your arm, which stays there for 14 days. Now let's get to diabetic diet. If you have diabetes, I'm sorry to say this, but you have to stop all sugary beverages. These include sodas, fruit juices, sweet teas, etc. Plain water will be your best friend. If you want a fruit, you can eat the fruit, but do not drink the fruit juice. It is a misconception that fruit juices are healthy. It is unhealthy even for a non-diabetic if routinely used. Same with sodas. The other main thing is to limit the portion size of your carbohydrates. You need your carbs, but lesser portions. When I say carbs, they are starchy foods. This include rice, potato, pasta, bread. Mind you, some vegetables like carrots and corn are not vegetables for a diabetic because they have carbohydrates and sugar in it. An approximate amount of allowed carb for a diabetic patient per meal is the size of your fist. If you want to calculate in grams, an average gram of carbs per meal should be around 40 grams. slightly higher carbs for men and taller people. Another method of controlling portion size is using a diabetic plate, which looks like this. When a diabetic patient takes food in a diabetic plate, half of it should be non-starchy vegetables, not carrots, not corn. Quarter or 1/4 of the plate should be carbs or fruits, and the rest 1/4 should be proteins, which is meat like fish, chicken, turkey, no red meat ideally, and the drink you should drink is, like I said, just plain water. The other method is to count your carbs by looking at the nutritional label of many boxed food items if you're in the habit of eating what we call the TV dinners. The other thing I stress to many diabetic patients on diabetic meds is that they should try to eat approximately the same amount of carb every day. This is to prevent fluctuation of blood sugars. In a normal person, if he or she eats a little more carb one day, the pancreas makes more insulin in response to it to address or to take care of the blood sugar and bring the blood sugar down. But a person with diabetes with impaired insulin secretion, the blood sugars are taken care by medications or insulin, which are usually fixed doses. Unless a person is adjusting insulin based on carb intake, he or she is taking the same doses of medication every day, and hence the importance of eating same amount of carb every day by a diabetic patient. That means if you have a sweet tooth and you're cheating, make sure you cheat every day so that your doctor can titrate your meds appropriately. But mind you, cheat only a little bit because the more you eat, the more you gain weight. Weight gain causes insulin resistance, which again causes elevated blood sugar, resulting in continued stepping up of therapy, which is hence is a vicious cycle. So it is always good to maintain your portion size of your carbs. For some patients whose A1C is only mildly elevated, who was very bad with diet to begin with and significantly overweight or obese right at the time of the diagnosis, diabetes sometimes can be managed just by diet control and mild weight loss. In a significantly obese patient, most of the time diabetes can be even cured by diet control and significant weight loss. So weight loss sometimes by using assistance from a weight loss program and incorporating active lifestyle like 30 minutes of aerobic exercise, like running or walking fast on a treadmill or outside every day will be great. I'm going to touch on medicines on another video because I don't want to make these videos really long and boring. So hopefully this was a little bit educational for everybody. The next video is only for diabetic patients who are on medications because it is of no use if you're not on any medications or you don't have diabetes. So thank you. Like and subscribe if you like these videos. Share it with your friends and family who has diabetes. Take care and bye.